my name's Savannah. I'm going to be your nurse practitioner today.
Hello.
How may I address you?
Grace,
Okay. And Grace, what's your birthday?
11/24/04.
All right, and what are we here for?
Just a regular checkup.
A checkup? Okay. Any allergies that you know of?
Just seasonal.
Seasonal? Okay. And any health concerns recently? Any recent illnesses or hospitalizations?
No.
No. Any food allergies?
No.
No. Any drug allergies? Just seasonal allergies,
Just
right?
seasonal allergies.
Okay, perfect. And how would you say your overall health is?
Pretty well.
Good?
Mhm.
Okay, great. All right, and any past medical history like asthma, high blood pressure, diabetes,
Sports-induced asthma.
sports-induced asthma? Okay. And you don't notice any flare-ups or anything when you're not doing sports? No. Okay, and you do sports often?
Yes.
Yes. What do you play?
Basketball.
Basketball? How many times would you say you have to use your inhaler?
Rarely.
Rarely? Oh,
Yeah,
good.
it's gotten a lot better.
Okay. Okay. Any surgeries?
No.
No tonsils out or wisdom teeth?
No.
No? Okay. And what about your vaccines?
I'm
those
up to date on those.
Yeah.
Yes.
Including flu and COVID?
Yes.
Did you have your flu shot this year?
Yes.
Okay. Okay, good. And do you take any daily medications?
Zoloft.
Okay. Do you know how many milligrams?
75 milligrams.
And what do you take that for?
Anxiety.
Okay. All right. And then now that I've kind of went over your past medical history, I'm now going to move on to your family's past medical history, okay? So we're going to talk about your mom. Is your mother alive?
Yes.
Okay, and do you know how old she is?
50.
Okay. And then does she have any medical problems that you know of?
She has thyroid. Something with her thyroid.
Okay.
Yes.
Do you know if she takes any medications for that?
She does, but I'm not sure of the name of them.
Okay. And then what about your father? Is he alive?
Yes.
And how old is he?
56.
Okay. And does he have any problems that you know of?
Anxiety, depression, bipolarness.
Okay. All right, now back to you. Who do you live with at home?
My mom.
Your mom? Okay. And are you in school?
Yes.
What grade?
I'm a senior at Ursula.
Okay. You're almost done.
Yes.
All right. And then do you have any religious preferences?
Catholic.
You're Catholic. Okay. And do you currently use any alcohol?
No.
Smoking?
No.
Drugs like marijuana?
No.
Okay. Good. And then how would you say your eating habits are? Do you eat well?
Yes.
You feel like you eat adequately?
Mhm.
Yeah? 3 meals a day?
Yes.
Okay. And then what about your caffeine intake?
Maybe once or twice a week. Not a lot.
Just coffee or energy drinks?
Coffee.
Coffee. And do you exercise outside of basketball?
Yes.
And how often do you think would you say you exercise?
3 days a week.
Okay. And what do you do when you exercise?
Cardio, weight training, a little bit of everything.
Okay. All right, so now I'm just gonna go over kind of all sorts of questions about your health, okay? In every system. So I know you said recently you haven't had any current illnesses, but you haven't had any like chronic fevers, chills, fatigue, anything like that, like tiredness?
No.
Okay. And then how is your vision? Are you seeing any blurred spots, any like blurred vision? How are your eye exams? Have you been to the eye doctor?
Yes, they're good.
Okay. Do you know the last time you went to the eye doctor? Do you wear contacts or glasses?
I do not wear them. I think I went at the beginning of this year.
Okay. Okay. And then, do you have any reoccurring headaches?
No.
No? Okay. What about any pain in your throat?
No.
When you swallow or just a touch?
No.
No? Okay. Any increase in nasal drainage other than seasonal allergies? I'm sure
No.
you get it then.
Yeah.
Nothing wrong with your sense of smell?
No.
Okay. And then have you noticed any shortness of breath? Where
No.
you feel like you can't catch your breath, or you feel like you need to use your inhaler more?
No.
No? Any wheezing or coughing?
No.
Okay. And then I know you said you have asthma.
Yes.
And what do you know when the last time you had a flare up of asthma was? When you feel like when you had to take your inhaler?
I would say a few months ago during like our one game I had to use it.
You had to use your inhaler, okay. And then you were better. Your breathing was
Yeah.
better once you used your inhaler. Okay. And then have you noticed any chest pain recently?
No.
What about any heart issues or palpitations, like your heart's running really fast?
No.
No? Okay. Have you noticed any extra swelling in your feet, legs, or in your arms or hands?
No.
No? All right. How is your stomach? Do you feel like you ever have stomach pain or bloating?
Some abdominal pain.
Yeah?
Mhm.
Okay. And how would you describe that abdominal pain?
Like sharp shooting pains.
Okay. Where is that?
Like my lower abdomen.
Okay. And when does that happen usually? Do you notice it happens like in the morning, at night?
A lot in the nighttime, like mostly after I eat.
Okay. Is it worse whenever you lay down?
Yes.
Yeah? Okay, and on a scale of 1 to 10, what would you rate that?
Like a 6.
A 6? Can you take anything that helps or do anything that helps relieve the pain?
Hot water bottle. Or a heating pad.
Okay. And that helps?
Yes.
Anything else?
I don't think so.
Okay. And then like how are your bowel habits with that? Do you
Good.
feel like it is better after a bowel movement or just no change?
It's better after about.
Okay. Okay. And then do you have any recent like nausea and vomiting?
No.
No? All right. And then do you notice any burning or increasing frequency, like you can't stop peeing or you don't pee enough?
No.
No, nothing like that?
No.
Okay, no smell to your
No.
urine? No discharge?
No.
Anything like that? Okay. And how are your periods?
Good.
Okay.
They've gotten a lot better. Yes.
Better?
Mhm.
Have you done anything different to help with those?
More
or-
active.
Active? So when you're active, you think that they're better?
Yes.
Okay. What would you say as in getting better? What do you mean?
The cramps aren't as bad.
Okay.
The flow is lighter.
Okay.
Yeah.
And when did you notice that?
When I first got my period, they were really bad. But then when I continued to get older, they got better.
Okay.
Yeah.
And you think they're better? They're like more manageable now?
Mhm.
Do you take anything to help with those cramps?
Midol.
Take Midol.
Or ibuprofen.
And you just take that whenever you're on your period?
Yes.
Okay. Any other concerns about your period or anything like that?
No.
No? Are they regular? Do you feel like
Yes.
you just get them once a month and they
Mhm.
could last about 7 days, like a regular cycle?
5 days. Normally.
Usually 5
Yes.
days? Okay, good. All right. Any recent rashes or like moles?
No.
No? None of that? Okay. Any sensitivity like bones, with your bones or your muscles?
No.
No? Okay. Have you ever broken a bone or anything? in your
Yes.
back?
My left arm.
Oh, your left arm? Okay.
Mhm.
When was that?
I think I was 6.
And that healed without surgery or anything?
It was just
In
casted.
the cast?
Mhm.
Okay, good. Do you ever get headaches or migraines?
Rarely.
Rarely.
Mhm.
Do you ever notice any dizziness or memory problems?
No.
No? When you get those headaches or migraines, do you take anything for those or what helps?
Advil normally, or a dark room.
Okay. And how often do you think you get those?
Closer to when my period comes, I think.
Yeah, okay. Do you think it's before our period or
Yeah, before.
Before. Okay. And you just take Advil and
Yeah.
dark room? Okay. No history of seizures?
No.
No. Ever notice any like numbness, like pins and needles in your arms or legs?
No.
No? All right. And then do you or anyone in your family have any history of bleeding, like bruising easily? Do you bruise easily?
I bruise easily. My grandpa bruises easily.
Oh. Have you ever had blood work for that?
No.
No?
Mm.
What do you do whenever you get these bruises?
Normally just ice.
Okay. And how do you get the bruises usually? Like when you're active, when you fall, or
Active, or if I bump something.
you bump something?
Yeah. But they normally just go away within a week or so.
Okay. They don't grow in size?
No.
They just, wherever you bump,
Yes.
it's good. Okay, good. Have you ever been told that you have a low blood count?
No.
No? Okay. And then lastly, I'm just going to go over just some questions about your overall mental health.
Okay.
How do you feel with your stress level? What would you rate that on a scale of 1 to 10?
Probably like a 7.
A 7?
Mhm.
What do you think you're stressed out about?
School,
School.
college.
Okay.
I would say those are two of the biggest stressors.
How do you deal with your stress?
Do something to keep my mind off of it, like going to the gym or talking about it to problem solve.
Okay. And who do you talk to about it?
Either my mom or just anyone in my family, really.
Have you ever thought about going to see a therapist?
Yes, I do.
Oh, you see a therapist? Okay, good. How often do you see a therapist?
Once a week.
Okay, good. When did you start seeing a therapist?
The beginning of my junior year.
Okay.
So
like 2020. Was that 2 or 1?
2, I think, yeah.
Okay. Good. Do you feel like that helps with your stress level and your anxiety?
Yes.
Okay. Any thoughts of self-harm or suicidal thoughts?
No.
No?
Mm-mm.
Okay. And then do you feel supported at home?
Yes.
Yeah. And how's your sleep?
I sleep very well.
Good?
Mhm.
Do you ever have trouble falling asleep or staying asleep?
Sometimes I'll wake up in the middle of the night a few times, but
Yeah.
that's about it.
Okay. And what do you do whenever you wake up in the middle of the night?
I normally put my TV on in it, and it makes me tired, so then I end up falling asleep again.
Falling asleep. Okay.
Mhm.
So just sometimes trouble staying asleep.
Yes.
Okay. And whenever you wake up in the morning, do you feel like you're super tired, like you just can't wake up during the day?
Not really, no.
Pretty awake whenever you wake
Yes.
up? Okay. Okay. All right, Grace, is there anything else you would like to discuss with me at this time regarding your appointment?
I don't think so.
No? Nothing else I can do for you?
No.
All right, well, it was really nice to meet you, okay? We will follow up soon with all
Okay.
this stuff, okay?
Okay.
All right.
Thank you.